we will talk about the 5 most common causes of vertigo and dizziness, their signs and symptoms, and the most effective treatments. When we say vertigo, we mean a person's perception that they or their environment is moving or spinning while they are not. Dizziness is a broader term that means a person feels off balance. It includes various sensations such as vertigo, spinning sensation, unsteadiness, and lightheadedness. Lightheadedness is a feeling of near fainting or weakness, often due to a drop in blood pressure, and is not directly related to vertigo. To understand why we have vertigo and dizziness, we first need to understand how we maintain balance. When we rotate our head, the fluid, endolymph, inside the semicircular canals of our vestibular system moves. This fluid movement creates pressure on a gel-like structure called the cupula. The cupula bends, which in turn bends the hair cells embedded in it. The bending of these hair cells generates electrical signals that are sent to the brain via the vestibulocochlear nerve. This mechanism is similar to the technology used in phones called a gyroscope. This is how we detect rotational movement. For linear or tilt movements, such as moving forward or backward or tilting the head right or left, we have slightly different structures containing a gel-like layer topped with tiny calcium crystals called otoconia. When we move, these crystals shift due to inertia, causing the underlying gel-like layer to move. This movement bends the hair cells beneath, generating electrical signals that are sent to the brain through the vestibulocochlear nerve. This helps us detect linear and tilt movements. This mechanism is similar to the accelerometer used in phones and other devices, which detects movement and acceleration. So, all of this happens in the inner ear, which is called the vestibular system. The vestibular system contains the vestibule and cochlea. The cochlea is responsible for hearing, and the vestibule is responsible for balance perception. Because these aforementioned structures are very fine and easily damaged, they need protection. The protection comes from the bone structures around them. The entire system, including these bones, is called the labyrinth. Now let's discuss the top 5 causes of vertigo and dizziness. The first most common cause is benign paroxysmal positional vertigo, BPPV. It usually occurs as brief episodes of intense vertigo triggered by changes in head position, for example, turning over in bed or looking up or down. A person may also have nystagmus, involuntary eye movements, during vertigo episodes. It can happen due to head trauma, age-related degeneration of tissues, or prolonged rest during illness or post-operative periods. It occurs because the aforementioned calcium crystals, which are for linear movement, become dislodged from their original location and travel to the semicircular canals. When the person moves, these crystals trigger false signals in the vestibular system. The risk of benign paroxysmal positional vertigo increases with age, especially after 50, and is more common among women. The most common triggers of benign paroxysmal positional vertigo are rolling over in bed, sitting up or lying down, looking up or down, tilting the head back to look at the ceiling or down to tie shoes. These vertigo attacks are often predictable, so the person knows what movements can trigger an attack. The treatment for benign paroxysmal positional vertigo includes Epley maneuver, a series of specific head and body movements to move the dislodged crystals out of the semicircular canal. Medications can be used during vertigo attacks, but they don't cure it or prevent attacks. Such medications include meclizine, an antihistamine that helps reduce nausea and dizziness; diazepam, a benzodiazepine used to calm the central nervous system and reduce vertigo and anxiety; promethazine, an anti-nausea medication. The Epley maneuver is a very effective treatment with a high complete success rate, but in 30% of cases, the symptoms can return within a year. It is possible to learn the Epley maneuver and perform it at home, but guidance from a medical professional yields better results. The second most common cause of vertigo is Meniere's disease. The most common signs and symptoms are recurrent episodes of vertigo, ringing in the ears, tinnitus, and fluctuating hearing loss, which sometimes worsens and sometimes improves. Attacks usually last for several minutes to hours, and hearing can worsen after vertigo attacks. The cause of Meniere's disease is the accumulation of endolymph in the inner ear, which physically compresses structures and causes symptoms. It most commonly affects individuals between 40 and 60 years old, but can occur at any age. For the treatment of Meniere's disease, no definitive cure exists, but for vertigo episodes, antivertigo medications, meclizine, antiemetics, promethazine, and benzodiazepines, diazepam, are used. For prevention, diuretics, hydrochlorothiazide, to reduce fluid buildup, and beta-histine to improve inner ear blood flow. A low-sodium diet is recommended to reduce fluid retention. Avoiding triggers, limiting caffeine, alcohol, and stress is also important. Hearing aids help manage hearing loss. Steroids or gentamicin injections into the middle ear. Surgery, such as endolymphatic sac decompression or vestibular nerve section in severe cases. Meniere's disease is a chronic condition with periods of remission and relapse. While there is no cure, symptoms can be managed effectively with treatment and lifestyle modifications. The third cause is vestibular neuritis, characterized by severe vertigo without hearing loss. The condition usually improves over time and most commonly occurs due to a viral infection. It can affect adults of any age, but is more common in middle-aged individuals. Patients commonly recall recent viral infections like the common cold or flu. Treatment includes corticosteroids to reduce inflammation, antiemetics, promethazine to control nausea, and vestibular suppressants, meclizine, for severe vertigo. Most patients will recover fully within several weeks. Another condition similar to vestibular neuritis is labyrinthitis. However, in this case, hearing loss can also occur and may be permanent. Labyrinthitis also develops due to an infection, either viral or bacterial, with bacterial infections being more severe. Treatment is the same as for vestibular neuritis, but antibiotics are added if a bacterial infection is present. The fifth cause is migraine-associated vertigo. In some cases, vertigo occurs because of a migraine headache. Vertigo can occur before, during, or after a migraine headache. Episodes can last from minutes to hours and can vary in frequency. It is more common among women. For acute attacks, triptans, antiemetics, and vestibular suppressants are used.